Okay, in this video today, I'm going to talk about inguinal hernia surgery, what you can expect from the surgery and what you can expect from the recovery of it. When you go in to have an inguinal hernia repair, there's two types of surgery. They can do the open, where they access the whole area. Then they can do the laparoscopic. I've actually had both. I had the open about 8 years ago, then I had the laparoscopic 2 days ago. So I am 2 days into the recovery of this. You notice it's one of the things that you'll notice right now is it's hard to catch your voice. You're very tender in this area, so it is hard to catch your voice. It's hard to talk, it's hard to get up, it's hard to sit down, those type things. But I'll talk about a little bit about the surgery. So you'll more than likely have a CT scan. They'll tell you have a hernia. You'll meet with the surgeon. You'll set up the day. On the day of, you don't eat anything before or after midnight. Typical stuff there. You go in that morning. They'll hook you up to the IV. Then you'll be asked a battery of questions by several different surgeons. Not surgeons, but nurses. Are you allergic to things? And there's just a lot of different things they're going to ask you about family history, heart issues, anesthesia in the past. Have it affected you badly? Anyway, so that you'll be all hooked up. They kind of got me a little bit. You'll see I've got pretty significant bruising in a couple of different spots from the IV where they had trouble with that. That's kind of neither here nor there, I guess. After a while, the surgeon will come in, kind of explain what they're going to do. The anesthesiologist will come in, explain what they're going to do. They will give you some medication for stomach to kind of calm you down a little bit as well. You remember everything up to that point. You go into the OR. I remember a ways in there, they were talking and discussing a few things. Then the next thing you know is kind of the recovery. When you're coming around, for me, that was about 4 hours. They did both sides of mine, so a lot of times the surgeons will tell you they can't do both sides, but they can. In this laparoscopic, they took out all the mesh that was put in there in the open that I had 8 years ago. So anyways, they did both sides. So then after that, you wake back up, you get you some ice chips, and then later on I had a glass of coffee and some water, and they really want you to be able to urinate before you leave, which is hard because they put a catheter in while you're having the procedure done, which then means you don't have anything in your bladder to go. So it's extremely hard to go. So one suggestion I would give you, start drinking liquids as soon as you're up and with it. And because they do want you to urinate before you go, and if you have nothing in there, you're going to sit there for hours, which is what I did. Came home that night, felt okay. You can eat kind of whatever you want. The next day, which was yesterday, was by far worse than today. You're going to have a whole lot of bloating, a whole lot of swelling, and a whole lot of pain. Now, I will say this, with the open technique where they're going to cut you all the way across, that pain was about 50-50 between the incision and where the hernia repair took place. With this laparoscopic, I'm at about 80-20, 80% pain in the area of the repair, only 20% around the incision. So that part of it's much better. I do still have a lot of swelling. Your hardest things are going to be getting up and down out of a chair and finding a comfortable position. If you sit and you're kind of hunched over, it hurts. If you lay and you're laying kind of on your side, it hurts. You can't really lay on your back all that well. Of course, you can't lay on your stomach. Getting up and down takes a while. It sort of takes your breath away. You'll get this feeling of your breath being really short. Again, eating's fine. Kind of eat and drink whatever you want afterward. But I think the biggest things you'll see is sort of the incision pain and then the pain in the area where it's done. Again, I had full both sides, left and right. You will see, I'll show you these incisions here. Probably not going to look great, but they do shave you, of course. I still do have a lot of swelling in this area, and then I have the 3 laparoscopic cuts. I feel remarkably better today than I felt yesterday. When I had the open inguinal repair 8 years ago, I was a full week before I started feeling really better, and really 2 weeks before I could do much of anything. Now, I don't feel like I could go do a whole heck of a lot right now, but I do feel far better now than I felt then. So the laparoscopic is definitely the way to go if you can. And I know there are different reasons why they do different techniques, but again, I think so far in this one, I've went from about a week of really feeling rough to just about a day and a half, something like that. So how well these hold up, I don't know. Again, I had a hernia on this right side 8 years ago, and I had another one, and they ended up taking out that repair. So it's hard to say how long you're going to get out of these repairs, and what the ultimate outcome is going to be. But I think it's better than going around with the constant pain in your side, and every time you try and lift something, or if you get up and down very much, you have all that pain. So I mean, I think it's something that definitely you need to look at and talk with your surgeon about doing. But that's a few things that you can expect. You'll probably need some help that first day. Today, after the second day, if you've had the laparoscopic, you probably could get by at least a little bit on your own. If you have the open, I would suggest you have somebody there the first 3 or 4 days. I remember that being a very difficult time of getting up and getting down. Even if you have a good chair, a supportive chair, it's still hard. One of those lift chairs would probably be great, where it can stand up and then just sort of slowly sit you down, and then it could stand you back up. I don't know what the feasibility for people at getting those are, but as far as walking, you can walk pretty well. I wouldn't try a lot of steps, but overall, that's a few things that you can expect from a laparoscopic and an open inguinal surgery repair. Give it a little bit of time, and hopefully, I'm hoping, again, this is a Thursday, I'm hoping that by maybe Monday or so, I'm feeling a lot better. So fingers crossed. But another thing I would say, if you could time this to where you can be outside like I am now, that helps a lot. Being able to come out and just sit outside for a half hour or so really does kind of cheer you up a little bit, make you feel a little bit better. Have your comfy clothes, and just give it a little bit of time, because that's what it's going to take.